Sorry I can't be there today. I happen to be caregiving for my husband, who's been a hospice patient since fall. I kind of thought the journey would be over, but it's not yet. So I'm coming to you virtually so that I can personalize the data that Dr. Albright and Dr. Washington have been telling you about. My goal here is to personalize that data and to give you some ideas of some social work interventions that can actually help and validate for you what my colleagues have said. First, I want you to understand that one of the things that I've learned as I've gone through this journey is that it's not as short as one might think. I think when we work in hospice, we focus on that very last period of time because that's what we're used to, when in fact, this is a long journey and it's a journey of a million losses. It's not just that journey of that loss of that physical presence of the person that you love, but it's a loss of many things. That basically summarizes it's the loss of the way of my life. And when we talk about social support in that context, as Dr. Albright was talking, social networks talk about the numbers of friends and family you have. But one of the issues with that is that one person can be many things, and you may be losing the number one social support that you have in your life. That's how it is in my case. My husband is not just my husband and the father of my children, but he's also my number one support system because he's my very best friend. And so you lose part of your social support system as a caregiver in this journey. The other thing is that as we think of shared decision making, everything you read about talks about the values and preferences of the patient, not of the caregiver. And all of the decisions that get made are in the context of the values and the preferences of the patient. Now, it's not true in my case, but I think it's probably true in more cases than not, that the values of the caregiver and the preferences may not indeed be the same as the values of the patient themselves. And so many times caregivers sit in silence and watch as decisions are made, even if they are shared decisions, about the person that they love, and they're expected to implement those when in fact they may not even agree that that's what they would like to have done. But they do what they are expected to do. Social support makes an assumption, and the theory that Dr. Albright talks about makes an assumption that the higher the number of persons in your social network, then the greater support that you have and the easier that the caregiving journey is going to be and the better that that is for you. We have shown, in fact, with our qualitative work, and it's validated by my personal experience, that numbers don't mean everything. Indeed, it is who is in that social network that is much, much more important than the number of people available. And the other thing that we have learned is that while you may have many friends, you may be reluctant to invite those friends in during this very special time because it just doesn't seem right to cross that boundary between friendship and your personal, more familial relationships. For example, I have a lot of friends at work and they're very close friends. They've been friends for a long time, but they've not necessarily been into my home and into my personal life. And this experience kind of breaks down those boundaries. If you ask for help from those friends, they become more like family. And we find that it's a little more difficult to ask friends for help than it is for family. And don't kid yourself, it's hard to ask family for support as well. Part of that is because you know the stresses that they're already undergoing. For instance, our oldest daughter, who's been wanting to be helpful, it's not like she doesn't have her own stresses. She's raising a 2-year-old and has a full-time job, and having been a mother myself, I understand those stresses. Or even more, our daughter-in-law, who is caring for her already ill parents, and now to put requests upon her and ask her for help is very difficult. And yet, she understands maybe more than most and has been very, very helpful. It's these kinds of dilemmas and the dilemmas around the shared decision making that led my husband to write down his values and preferences and to share those with our social support system so that we can all be on the same page and understand what decisions need to be made. And as our family has gone through this and watched my husband make decisions based upon his values and preferences, we're hopeful that when the time comes and we have to make those decisions, we'll be better off making them, and we'll know more about how to do that. The idea of shared decision making is a really important one, and a really hot topic right now, and it sounds great. But you need to understand the challenges that face patients and families when it comes to this. For instance, it's sometimes really hard to understand what's behind the problem, especially when it's a medical problem, and to understand the solutions that are being proposed, especially if the patient education isn't happening along with those. All of this is complicated by all of the emotions that you're feeling at the time, and even some cognitive impairment that can be going on that can complicate this. You know, my husband has energy, really quality energy, maybe a couple of hours a day now, and the emotion that it takes to make those decisions and the energy that's required to do that, he's a little reluctant to spend that. We're kind of selfish with how we want to spend that energy in those 2 hours. I also have limited energy, and some things, quite frankly, are just not worth fighting for, and not worth battling at this particular point in our time. And so, what is it that social workers can do to help support our social support and help teach me how to access that social support appropriately, and to facilitate shared decision making? The first thing I want to say as social workers is, don't assume that somebody else is taking care of the caregiver, because it's simply not true. The caregiver doesn't belong necessarily to anybody's intervention list, and even the team. Not sure how many of you have care plans for caregivers as well as for patients. Probably caregivers are a little piece of that, mostly telling them what they need to do rather than what they need to be helped. And so I'm going to encourage you to take that role, and that social work be the ones that embrace the caregivers and become their primary support. And I'm going to give you some ideas on how to do that. But please don't assume that somebody else is doing that, and don't assume that they don't need help because they say they don't need help. You need to make that assessment. So what can you do? Well, one of the first things that we did that I think was an excellent idea, and it was given to me by a former social worker in an oncology clinic who's now a social worker in palliative care, was to create our own personal plan on how we were going to do something and how we were going to handle things when times got tough. We happened to title our plan Operation Hope, and we chose to primarily make that a plan that involved our family, mainly our children. This I've shared with you. It's in your handouts as an example. Now, understand that we put that in the context of what it meant to our family by using a military example. And there's a story to that. It's got nothing to do with the fact that we're a military family, but we call ourselves the Oliver Army, and our General David is in charge, and so we used that analysis because it's familiar to our family. And it helped us to think through decisions and plans and roles for all of the kids before we had a crisis. We established some ground rules and some values that were important to us. Now, there's a couple of different ways to think about how you communicate such a plan, and I think the social worker can play a key role in facilitating that. I think ideally you'd probably have a family meeting and talk about that. That didn't work for us because we couldn't ever get all of our family all together at the right time. And my husband ended up being a little reluctant to share that plan with the kids. So they all knew there was a plan, but they haven't read it. But it did give us an idea of how we were going to utilize the kids. And without formally announcing the plan, we've shared with them what we need from them. For instance, our daughter, who is the gopher, as we call her, she is aware that that's her role, and she's using it. Another daughter whose role was to deal with the social support has been very helpful, and she happens to be a social worker, and she's helpful in calling me to access that. But you can choose, families can choose to implement that plan however they want. I think the most valuable part of it is thinking through. Another thing is that we need to teach caregivers advocacy skills. I'm obviously a trained advocate because I'm a social worker. But there's a whole lot of difference between advocating for my husband or advocating for your client and advocating for yourself. And one of the things you can do is to help caregivers be self-advocates, because it's a very uncomfortable thing to do. Teach them how to take care of themselves and to do self-care and to be comfortable saying, I need help. Because that's a very uncomfortable thing for us to do as caregivers. Also, very practical skills. Teach them how to keep data, records of what goes on, so that then they can be better advocates for their loved one. Writing down all of the pain medicine, all the breakthrough pain, has allowed me then to advocate when it's time for us to do something about the pain control that needs to be improved. Also, I keep a notebook that writes all of that down and organizes things that I need to tell the nurse, and I write down questions on the day that we're going to go visit the doctor. And maintaining those is a very solid tool that allows me to be a better advocate. Teaching caregivers how to communicate better and communicate their needs, and giving them some tools to do that. How I wish I had some handouts from my hospice program. One thing that would be very helpful is a handout or a poster from my hospice program that has the hospice name that I put on the front door, that tells visitors how to be good visitors and to keep their visits short so that we don't end up with them staying for 2 hours and totally monopolizing time. Coming from a hospice doesn't feel rude. Coming from me on the door would feel rude. And so giving that kind of thing. How about supplying caregivers with handouts that they could give to friends, how you can be helpful? Just a list. These are the things that you can do to be helpful. Because one thing I've learned is we need to teach social support systems how to be supportive. Many people say, what can I do? And I don't know how to respond to that. Teaching me what a list of things that they might do, or having a list so that I can hand it to them. Please give me a call when you're at the grocery store and ask me if I need anything, because if you're there, I'm more likely to ask for help than I am to call you and ask you to come. Or if you have food, give me a call and tell me that you've got some food that you want to bring by and you're just going to drop it at the door, and I can do with it whatever I please, but you were thinking about me and you just want to drop it off. And then I'm not asking. And wow, how helpful is that? So any kind of suggestions that we might give to families' social support system, and then I can hand that out. It's from the hospice, it's not from me, and it doesn't make me feel like I'm asking, but rather that I'm helping them to help me. And I think I've got some other hints on the slides that are in the handout that I don't have time to go over. So I'd encourage you to take a look at those and incorporate those into some handout material. Let me kind of summarize for you our session today and its impact on me. First, you need to understand that caregiving has a dramatic impact on the health and the mental health of caregivers. They're emotionally and mentally exhausted, and research has proved over and over again that it impacts the morbidity and the mortality of caregiving. Myself, I've been in the hospital. I've had 2 asthma exacerbations, and as those of you who know me can see, I've put on a lot of weight. Secondly, social support is really, really valuable, and shared decision making is very important. And social work has a role in helping to implement those things for caregivers specifically. The first is to assess those things. Find out what the social support is, not just the number, but who are these people? What resources do we have here in this family system? And how can we help the caregiver access those? Focus on the caregiver and on assessment of the caregiver, because nobody else is doing that on the team, whether that be palliative care or hospice. And finally, plan interventions that help the caregiver to use the social support and prepares them to be active decision makers both in a shared decision-making capacity and, quite frankly, when they're going to have to make the decisions for their loved one because their loved one's not able to do that. I hope this has been helpful. Wish I could be there with you, hoping that you're having nice weather and that you're enjoying the conference. Please ask Drs. Washington and Albright questions because I know we didn't answer them all. Have a great day and a great conference. Thank you.